Hi, Dr. Sumi here, and I'm coming to you today with another video to talk about AI in the ER. Now, there's a lot of different uses for AI in medicine and in the ER as well, and I just wanted to be clear that this is purely based on my experience. I'm sure many of you out there, especially the medical professionals, are using AI for a variety of different things, and so this is really only going to talk to what I've seen and personally used myself. And there's probably going to be more videos on this topic as the capabilities of AI expand and time goes on. The first thing I want to talk about are these passive listening devices, also known as AI scribes. Scribes are professions for people who work in the emergency department and other areas of the hospital and typically do the notes and charting for the physicians. They listen to what the doctors are saying, they listen to the interviews with the patients, and they put all the data down in the medical chart. It saves the doctors a lot of time because charting is one of the largest things that we spend our time on, especially in the emergency department as we see so many patients. These passive listening devices, generally you download them onto your phone, you turn them on to record, and you leave them on when you're talking with the patient. After you finish the conversation with the patient, getting their medical history, trying to understand why they're here, and possibly even formulating a plan there with them, you finish the recording, and this will take all of the relevant data out of that conversation and put it into an HPI, which is the first part of the medical record. Now, it is surprisingly impressive when it works. How it's able to pull out the relevant parts of the conversation is very impressive to me because the human conversations often go in different directions. There's different angles and things that we talk about, and somehow these listening devices are able to parse out the relevant information and put it in a very readable format. It can pull out patients' medical history. If they mention they smoke, it would mention that in the chart. It's just very good when it works. Now, I say when it works because there are significant limitations to these kinds of programs. One is it's technology dependent, right? So it is a passive listening device on your phone that requires a continuous internet connection in order to send the data, process the data, and then receive the data. So there's limitations to that from a physical standpoint. Your phone is going to be hard always to hear in the emergency department where things can be very loud. It can be obscured, and as well, the limitations of having internet in the ER at all times can also hinder the ability to use this. There's also limitations in conversation. These are listening devices that are trying to listen to human conversation and parse out the medical data. Unfortunately, or maybe fortunately, I should say, human conversation is quite diverse. We make jokes, we can talk about euphemisms, and as well, there's other slang that the AI just probably will not pick up. You'll read sometimes the chart that the AI has written based on the conversation, and it will put things down very literally because it does not understand the tone of the patient or the euphemisms that the patient is using. And that's just a limitation of the device. The second area that I've seen AI used in the emergency department is with imaging interpretation. Now, X-rays, CT scans in my hospital already have an AI integrated component to them. I'm notified right away if a CAT scan of the head shows an acute bleed or an acute stroke. These messages are pretty quick, and I'd say this technology is pretty good. It's very easy, from what I know, to train an AI on thousands of images. And AI is able to quickly kind of learn what a person would in multiple years of residency training, training themselves on what is normal and what looks abnormal. Now, while it is very good, there is still room to grow. Of course, the AI does not always know the clinical context regarding the patient. They're always looking at images in isolation often. They don't have historical records for the patient. If the patient always had a certain nodule, it might recognize this as a dangerous thing, even though it has been in the patient's record already for some time. And these are pretty simple things that I think will be smoothed out over time. But so far, I think there's great promise with AI and imaging interpretation. The third way that I've seen AI used in the ER is with the MDM. This is the medical decision-making part of our chart. It's also known as the impression and plan. This is the last part of the chart where we talk about our medical logic, the relevant results, and the disposition and outcome for the patient. AI is very useful in this way as it's able to synthesize everything that happened in the visit in a very concise way that sounds articulate and can help structure your decision-making charts. The way that people can use this is they can put their HPI in, they can put the story of the patient in, the relevant information, what happened to the patient, what the test results showed, what the imaging showed, and what the ultimate outcome was for the patient. They were admitted, they went home, whatever it was. and AI is able to kind of synthesize that in a very readable format. Part of this is because AIs are typically large language models, so they're already designed to be verbose in a way that's very readable and presentable for the reader. ER doctors are kind of notoriously known for not having very well put together charts. Oftentimes, you'll look at a chart for a patient and you'll see what the ER doctor wrote, and it'll just say chest pain, x ray negative, EKG normal, normal cardiac testing, well appearing, discharged home to follow up outpatient, right? And I have seen many charts like this all over the place, and they're just simple one liners down the line. If they were to put that information maybe into an AI that is structured to synthesize that in a more digestible way, you might get more of a better result in terms of your readability if you were to review that chart again in a future scenario. And that's all I've got for you today. All right, thank you so much, and until next time.